There are many different reasons that the front of your eye, which we call the cornea or the windshield of your eye, can become foggy. For the reason that we're seeing you, we have noticed that the cornea is pretty much clear through the first 4/5 or 4 to 5 layers of it. But the back layer of the corneas have a lot of pumps on them. And so the cornea is clearer than the rest of the body, or my skin, usually because it's drier than the rest of our body. Now, why is it drier? Well, we have pumps on the inside of our cornea. These pumps are called endothelial cells. So their job is to pump out fluid, make sure that the cornea is drier so all the layers of the cornea line up properly. But what happens if you have something called Fuchs endothelial dystrophy? Or if you had some sort of viral infection, or if you had a trauma to your eye, or if you had previous surgery that might have been complicated, or just naturally over time, you end up losing the pumps. All of those changes that I just mentioned can cause you to lose those pumps quicker than normal. So when the pumps stop working, fluid moves into the cornea and the whole system gets steamy. So an endothelial transplant, of which there's 2 types, one is called DSAEK, DSAEK. It stands for Decimase Stripping Automated Endothelial Keratoplasty, or DMEK, which stands for Decimase Membrane Endothelial Keratoplasty. There are different types of ways to replace the cells in the cornea by removing them, taking a piece of tissue from somebody who's passed away and donated their cornea, using those tissues and floating them up into the eye. Both of these procedures work very, very well. The chance of a surgery for DSAEK or DMEK going well is well over 95% of the time. In these surgeries, it's necessary to lay flat, because when I do the surgery, to keep the grafts in place, I do not use stitches. I use air or gas, and that gas rises up into your eye and holds the new tissue in place. So as the tissue starts pumping, it will lock onto your cornea and then clear it, and your vision can improve. Whether you're recommended DSAEK or DMEK, we will have that conversation when I meet with you. And the DSAEK and the DMEK procedures can be combined with a cataract surgery at the same time.